Mr. Speaker, I rise today to share with you stories of real people from Colorado making the case for why we need health care reform in this country. I have a constituent who lives in Westminster, Colorado. He asked that his name not be used. He shared with me that 10 years ago, after his son and daughter were married and they began starting a family, they're both small business people, own and operate their own business. Neither one has employees, and both incomes barely pay their bills. They found that insurance was unavailable for them. They were in their childbearing years, didn't have large amounts of disposable income, and didn't have enough equity in their businesses. So, like a lot of Americans starting out trying to build a company or an idea from scratch, they scrapped together what they could. They saved nickels and dimes in an effort to collect enough money to afford to have the baby and family that they wanted. Fortunately, they saved part of the necessary $10,000 for hospital expenses, and the hospital agreed to give them a payment plan, kind of like buying a car. They had a beautiful little girl. Shortly thereafter, a second child, a boy. The oldest child is about 4, and they still haven't been able to pay off their debts to the hospital for their 2 children. Those debts continue to hang over their heads. They pay a monthly bill that's attached with enormous interest. The irony in this story is that their businesses are now doing better. They have employees, and their equity positions have blossomed. Now the insurance salespeople call, begging them to accept their coverage. They take the obvious position of refusing to sell when the chance of payout is high, and begging the sale when it's obvious they will be selling 2 healthy young individuals who have the wherewithal to pay all their bills. The gentleman from Westminster who shared this story believes that we need to make sure that future generations of Americans don't face the same difficulties that his daughter faced and son-in-law in raising their family. To be born into a legacy of debt before you even speak your first words. Under the proposed health care reforms, we can ensure that small businesses, self-employed individuals have access to low-cost exchanges. Small businesses receive tax credits to help them afford the cost of health care. Depending on people's income level, for a family of 4, up to $73,000 a year in income, that family, that's about 400% of poverty, the family will receive affordability credits or vouchers to be able to use at the insurance provider of their choice. By helping put insurance in reach of more American families, we can help improve the peace of mind and health outcomes for families like this family in Westminster nationally. Thank you, Mr. Speaker.